The KEYNOTE-224 study evaluated the efficacy of pembrolizumab in the second-line setting of HCC. As you know, we have now 3 studies and Phase II and Phase III studies for pembrolizumab in the second-line setting. A global study which was unfortunately negative, despite really very promising data. So it was actually the longest median overall survival we have ever seen in the second-line setting in HCC with almost 14 months. And these data were also confirmed in the update of the KEYNOTE-224 study, which we presented at ESMO GI. This was the single-arm Phase II study. And similarly, as in the Phase III study, median overall survival was almost 40 months. Response rate, PFS was very much in line with what we have reported before. So there is activity, as said before, in the first-line setting for durvalumab and checkmate. However, unfortunately, in this case, efficacy was not sufficient that we have a positive Phase III study, and with that there was no approval for pembrolizumab by EMA. It was approved by FDA, but not in Europe. I think it does not really matter today because we have now positive Phase III studies with IO-based combinations in the first-line setting. Therefore, I think we do not probably need these options in the second-line setting. Nevertheless, I think the data are important because it confirms the efficacy of checkpoint inhibitors in HCC. There were some interesting exploratory analyses like what is the outcome of patients that responded immediately at the first CT scan, and here outcome was really exceptional. Median overall survival was not reached. Yeah, so I think we can use these response analyses, early response, overall response, kind of a surrogate marker for the prognosis of our patients, which could be helpful for the discussions with our patients. So I think the data confirms what we have seen before, but as said before, probably will not have a significant impact for our decision making because we will use the checkpoint inhibitors more in the first line setting.